Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter V. Today I'm going to talk about the varicosis of veins. It's really, it sometimes depends on the systemic disease or depends on the location of the vein and may have the serious consequences because of this varicosis of veins. So first of all, let me just bring up the emergency situation before I talk more about the mechanisms of the vein structures, what are the causes for this varicosis. So the emergency situation is really the bleeding, particularly if there's the venous system between the portal vein system and also systemic venous system. With this abnormal varicosis and through the anastomosis, so that if that's the case, then the pressure is high, so really the blood vessel the vein walls are thinner with the pressure higher, so that increased risk of bleeding. Actually, it could be massive bleeding, life-threatening. So talk about that. We probably know it is the varicosis of esophagus veins. It's the anastomosis between the systemic venous system to the portal venous system, so that's caused the varicosis along the esophagus. And particularly, so these are the special situation if those people who had hepatic diseases, either caused by the chronic hepatitis or alcohol caused the cirrhosis, and your physician will do the test and you swallow the barium, will tell whether you have or have not this varicosis around the esophagus. If that's the case, your physician probably already told you how to prevent eating solid, eating the soft food, or or treat the disease of original, which is liver disease. But usually it's irreversible. So if that happens, you probably just have to be prevent from the heavy bleeding. However, if you have those history of cirrhosis, either caused by the hepatitis or by the alcohol or any other causes, and you develop this bleeding, vomit, blood, so you need to see the emergency as soon as possible to stop the bleeding and to do the surgical management sometimes. So this is the emergency situation. Can you manage at home? There's some other causes. I'm not saying you manage at home, you just live with it, but just with some consequences. For example, the saphenous varicosis of saphenous vein on the leg, that's cosmetic reason, and sometimes increase the risk of the ulcer or infection or abrasion. So these are the, you probably know it. So let me just explain a little about this varicosis of veins. First of all, the veins are different from arteries. I talk about the arteries disease. The veins, the wall is thinner, lack of the flexibility or elasticity of the artery wall. And also the veins have the valve. Inside of the veins, there are valves to permit the blood going in one direction. No backflow. The purpose is different, but artery do not have this because artery has a thick wall with muscular structure can constrict. The wall of the veins are thin, minimum muscles, so cannot constrict. So just the blood was just pulling back to the heart by the negative pressure to suck it in, and also the valve prevent to backflow. So this is the venous structure basically. So for the mechanism of the saphenous varicosis, it's because this valve structure is not function. The blood just pulling, and also there's anastomosis, that's just the branches together. So you have a lot of vein there wandering around and dilated. So if that's the case, usually it's asymptomatic, only a lot of people just consider, particularly the risk factors for those who are standing a long time and with loss of the muscle strength, the muscle constriction, on the other hand, also can help the venous drainage back to the heart. so loss the muscle strength, atrophy. These are all the risk factors to increase this varicosis of 7-year vein. So if that's the case, I think the better is to stripping it, which means to take some of them out. Since it's not function, and you don't need to worry if you take it out, there will be side effect there, but the minimum, because there's sometimes anastomosis is not good, but sometimes it's good. When this dysfunctional 7-year vein was stripped out, and then there is a anastomosis forming the branches, and still can serve the same function. Particularly if you have this varicosis of 7-year vein and impaired your function, increased risk of infection, ulcer, abrasion. So that's not just the cosmetic. So you probably need to talk to your physician to consider doing something to make it better. And the other common varicosis of the vein is the portal vein hypertension, which because the liver problem causes this portal vein hypertension, has to find anastomosis between the systemic circulation, also the portal venous circulation. So for example, for those people, you probably have a lot of venous structure around your umbilical or the belly button. It's called caput medusae. So which means you imagine that Greek mythology, there's Medusas. It's like that shape. There's a lot of veins around the umbilical on the belly button. So that's one of the place. It just it's there, and also around the rectum, and also another one. Actually, is one of the most serious, dangerous varicosis is the esophagus. It's the esophagus vein, and also the portal vein formed the anastomosis and increased risk of bleeding. So this is the important of this. There's some other places for this small varicosis, probably asymptomatic, not affect any problem. And sometimes the varicosis, like I said, serve good purpose to provide the side pathway for the blood supply or for drainage back to the heart. So anyway, the risk factors for the portal hypertension, I think I mentioned, I had a previous video talk about that. Chronic hepatitis is one of the most common cause nowadays, and actually it's, the hepatitis caused hepatic portal hypertension actually is probably one of the most common cause in past decades, not current. Right now, because the immunizations, hepatitis B caused portal hypertension is not that common. However, hepatitis C caused the portal hypertension still. It's one of the most common causes. The other common cause is alcohol caused the cirrhosis. So this is in order to prevent this varicosis between portal vein and systemic venous system. So you have to prevent the liver cirrhosis, or sometimes the genetic causes for the biliary tract problem, cirrhosis, sclerosis, cause this hypertension of the portal vein. And in terms of the varicosis of the 7-year vein, I think exercise and prevent standing long. If you do, you just move your legs, move your toes, move your foot. So to increase the muscle contraction, to squeeze the blood back and promote the venous function. So this is about the varicosis. I think I just put it here for those who are interested or who may have it but not draw your attention. Then you probably know it, and then seek your medical advice. Talk to your physician about the options of treatment. So I'm going to stop here, and thank you for watching. I'll see you next time.